Yeah, that's how we do it on a Sunday afternoon. I do believe it's the 25th of September already. The dates change, but the dial doesn't change. 99.7 FM. Call it a frequency, I call it a family. And the program is Ultimate Health. You may call it a program, I call it a promise. Listen every Sunday, 2:05. If it impacts your health and well-being, Ultimate Health is the program to lean on. Hey, we're right here every Sunday, 2:05. You can lean on us if it impacts on your health and your well-being. It's called Ultimate Health on Joy 99.7 FM. That's right, and you can call me Nortey by nature. Welcome to Lean on Us, Ultimate Health on Joy 99.7 FM with me, Nortey by nature. You can call me. 3 weeks in a row. That's a hat trick, right? I've had the dentist in the studio and they're back. Dr. Patrick Banamanagbeshi.
You know he's another OPK.
Sam J Specialist Hospital, Hacho. And Dr. Albert Hammond is lead dental consultant at the Nabita Hospital, Community 4 Tema. We've been looking at tooth decay and cavities. Today we're going deep down below sea level. Yeah, tooth extraction. Or having your teeth or your tooth pulled. And when we have those cavities filled, let's get into that and find out what exactly the deal is, where the proper place, the proper professional can be found to undertake these processes. And we'll learn all about that with my docs in the studio. Docs, you're most welcome.
Thank you very much, Nortey.
Right. I'm sure you were enjoying the flight entertainment. Yes. Michael Bolton, one of my favorites, Lean on Me. But you're most welcome.
Thank you.
Yeah, thanks for sharing your Sunday with us. So we've gone through most of the basics. And just like the 3 levels of the tooth, from enamel to dentine to the pulp, we've been descending, if I can say so. Yes. Right? Now we want to get into the deep stuff, what you're doing. And pulling or extraction of teeth is one of the common procedures we associate you guys with. Sometimes that even accounts for our fear of you guys, right?
That's right.
You established and confirmed for us that is a last resort. Your rule of thumb is to preserve the natural tooth or teeth as much as possible.
Yes.
But inevitably today we have to talk about extraction. If you've just joined us, our WhatsApp is 055 11 11 997, and we're going to be pulling a few facts from the dentist. So what exactly is extraction? Is it exactly what it says it is? Is it basically simply fundamentally extraction?
Okay. So we want to say good afternoon to all our listeners once more. And extraction is, to make it very simple, it's a surgical procedure whereby either part of a tooth or the whole tooth is taken out in a very clean and systematic manner. Okay. So what most people have in mind of an extraction is you just what we see in the movies. So you tie somebody in the chair and you just yank the tooth out.
That's all.
Yes, but that is not how it happens in real life.
Okay.
Yes, in real life, after the assessment is made,
real professional clinical.
Yes, you've done everything you can.
Right.
From examination, you do your investigations, then you come to the conclusion that the tooth must be taken out. There's a sequence of procedures that will go through, starting from the anesthesia, making sure that the anesthesia has set in properly. You test, and then we have a series of things that we do to get the tooth safely out as much as possible.
Let me ask this question. Of course, your ultimate goal or objective is to protect and preserve the tooth.
Yes.
Can we hit on a couple of the scenarios in which extraction will be indicated, or extraction is something you would opt to do?
Okay.
I don't know whether Patrick will take that. Yeah.
So traditionally, if you have a tooth that has gone through the stages of the infection or the carious process, and we have the infection going beyond the tooth, that's beyond the pulp, breaking through into the bone, and then finally into the gum or into the soft tissues, you realize that the tooth has to go.
So in instances of advanced decay,
yes, we call them an abscess. You are more likely to see the person with an enlarged jaw or a very heavily dependent part where the infection is. That's one of the cases. And the point where also the crown of the tooth, that's what we see, the white part we see in the mouth is gone. And you just have the retained roots sitting in the bone. Also as a possible source or point of contact of infection from within the mouth into the body. An extraction is needed. Also for sometimes wisdom teeth, which if selectively known to be not favorable to the other teeth that stand within the lower jawbone or the upper jawbone, to safeguard those who would carry on function, we selectively take out those wisdom teeth as well. So those are a few instances.
Or if there's been trauma.
Exactly.
To the tooth. And I read somewhere that sometimes in instances of overcrowding, either the teeth are too big, too squashed, misaligned, and so on and so forth, that may also be an option.
Yes. So as a requirement for orthodontic treatment. So what we usually call wearing of braces. Yes. If there's not so much space in the mouth, we will do an extraction to create space for the teeth to be aligned properly. Then there are instances where the baby teeth have overstayed in the mouth. And the permanent teeth are ready to come in, but because the baby teeth are still in the permanent teeth may come out in the wrong direction.
Okay.
So you need to go and pick out.
You do a big brother eviction.
Exactly. Yes. And then finally, sometimes when somebody needs some head and neck surgery, and it's identified that they have certain teeth that are not in very good condition.
Okay.
Before the surgery, you need to get those teeth out.
Okay.
Before that surgery can be done.
All right. So there may be different scenarios that may require extraction.
Yes, that is right.
Okay. Now, let me ask this one again. I mean, hey, it sounds cheaper, it sounds natural, it sounds like God's way, but the thing is wobbling. It's been a bit problematic, but now I don't even feel anything, but it's wobbling. And it will go by itself.
That's right.
Do I really need you guys? I mean, it will go. And I can decide to throw it away, put it in a jar, worship it, anything like that. But basically, there's been a natural extraction or tooth loss. What's wrong with that?
That would traditionally come out of gum disease, untreated gum disease over the years.
Oh.
So every tooth that you see sitting in the mouth is supported by predominantly two things, the gum and then the bone.
Okay.
So we mentioned the other time about routine checks where the cleaning is done. The big word that we used there was calculus.
Right.
That's more like a house for bacteria.
Okay.
When they continue to destroy the gum and the bone, which is the support structure of the tooth, you would lose the support, and then the tooth begins to wobble and shake. That is preventable if we keep to the routine checks. However, if you decide to sit and allow it to fall by itself or fall out and worship it in your little glass jar if you want to, the disease process goes unchecked and you lose a lot more bone moving forward, meaning that you are more likely to lose several other teeth along the way.
Because you haven't addressed the root
cause of the problem.
Okay, so it is not to be considered natural,
normal.
After I have gotten my adult set of teeth, that after some time I would lose a tooth. It's not natural.
Your teeth should last you your lifetime.
Oh.
Yes. I have a 90-year-old patient who has all her teeth.
Yes.
Oh, okay. All right. 16 minutes past the hour of 2 on Joy 99.7. Stop looking into your mouth. We are just establishing that it is not normal to lose your teeth without any trauma, without any disease, and so on and so forth. So obviously something has gone amiss.
Yes.
And that is where and probably how you're likely to lose your teeth. They're supposed to last you for life, and therefore you will not need to go to Swami or Kokompe for spare parts. Okay, right. Oye in Afienya is welcoming us to her home. Oh, today Oye is not kitchen, home. Okay. I hope you're tuned in. This is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm in the studio with the dentist. We're continuing. Hopefully this could be a last installment, then I give them a break, right? With the dentist on tooth decay and cavities. Today we are looking at tooth extraction, or having your teeth pulled out, and the filling of cavities. We'll be finding out about these things. You can share your questions, concerns with us, 055 11 11 997. Those are the digits for our WhatsApp inbox, and we're live on Facebook and YouTube. Shortly I will activate those phone lines for you. All right, so we've gotten an understanding of the reasons for which an extraction may be indicated. Yes. All right, now before you got to the anesthesia or whatever, and I guess we'll have to explain why you need to have this done with some level or degree of anesthesia, but so it's shaking or it has a hole in it and all that. What you're saying to us is that it must be assessed properly.
That is true.
You don't just go and yank.
No.
All right. You must know what the issue is and whether the extraction is properly supported or justified.
Yes.
And safe.
Yes. So there are other medical conditions in which you can suddenly start having your teeth very mobile. Okay. So if all you do is go somewhere, they pull the teeth out, and the investigation is not done. Now, like Patrick said, that other disease process will be going on. So this is not a disease process that is only in the mouth. This is like the whole body, but manifestation in the mouth as you having very loose teeth.
Right.
Okay. So the investigation part is very, very, very important. And after the whole goal is to prevent further tooth loss. in the future, or reduce the number of teeth that might be lost to the barest minimum.
Okay.
Yes.
All right. Okay. So the condition of your mouth is quite indicative of your state of health.
That's
right. And there may be other things going on which are not in the mouth, but may manifest in the mouth. So that assessment is critical. Yes. You don't just go and insist or request that your tooth be pulled,
no.
and they too do the quack, 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 and then they pull it out, and you're relieved.
Yes.
Right. A proper assessment must be done. Right. That's what I wanted to establish before we get to anesthesia and other things. So
that's right.
You've assessed. Right. So do you just put me in a chair and then do your do, or what happens next?
There was a conversation to be had.
Oh, okay.
With the patient,
yes, with the patient. That's from the discussion we've had, which is the consultation,
okay,
and the clinical findings that we picked up, backed or confirmed with a radiograph. That's traditionally what we call the X-ray.
All right.
This is the state of the tooth. These are your options. There's always more than one option.
Okay.
Okay, so maybe you could choose a very complex procedure called the root canal to save the tooth, depending on how deep the cavity is, or how close it is to the pulp or a filling, or then worst case scenario, the extraction. And then the clients or the patients, within very sound mind, should be able to decide for themselves.
Is that a consent process? Am I required to give consent for my tooth to be pulled?
Yes.
That's right.
Very much so.
The dentist has no right to, should I say, bulldoze you into the chair.
You brought your mouth?
No.
Oh.
No.
Yes, because it has legal implications.
So there's a consent process?
Yes.
Is it formal? Do you sign anything?
Yeah,
because it's a surgical procedure.
Yes, surgical
in a
procedure. Every clinic has its own protocols.
Okay.
In some clinics, because of things that have happened in the past, we will insist that you have to put in a signature. But for most clinics, I mean, once you give us your verbal consent, and it's documented in your folder, because we gave you options, and then you chose that you wanted to have the tooth extracted. That in itself is considered
sufficient
good enough.
And adequate. Okay. Yes. Folks, it's 21 minutes past the hour of 2 on Joy 99.7 FM. And if you can hear me loud and clear, then I have your consent. Yeah? You can switch off, but I know you won't. You're addicted to us, yeah? But we're doing good stuff here. We're trying to understand this process. So now we're about getting ready. You are in the chair, you've had a chat, you've understood your options, you've said some kind of aye or and the dentist is now going into the procedure proper. Right. So how is this done? If we can just break it down into quick steps and still save some time to talk about cavities.
Yes. Typically, make sure that the patient is very relaxed.
Okay.
The approach differs from children, if you have a child patient, and an adult. Children need more work to get them to relax. But the first thing is
them and relax them.
Yes, they make sure the patient is as relaxed as possible. Sometimes we may need to sedate the patient. Okay. If the person has a lot of fears, but we still need to get the work done. Maybe you postpone the first time, second time now we need to get it done. Sedation is an option. Then we give the anesthesia, whether a block or infiltration. Just to make sure that the tissues around the tooth that needs to be taken out, the place is well numb.
Right.
When it's after some minutes, we would ask you, how do you feel?
Can you feel anything there?
Do you feel any changes, in your mouth, around the tooth? Then we will, after you give us the response, we will also assess on our own to be sure that the place is fully numb. So once anesthesia is established, the next thing is for you to, with gentle movements, very gentle movement, because you don't want the tooth to break during the procedure. That is going to cause another wahala for the patient. So very gentle movements, and then you deliver the tooth out of the socket. Once tooth is out, make sure that you secure the bleeding at the site. Either you make the patient bite very hard, or you can suture the place. You have hemostatic sponges, depending on the person's medical condition, whether it's a heavy bleeder or normal bleeder. We have various things that we can do to secure the bleeding. Make sure your patient is still very relaxed. Deliver your instructions. What should you do the first day? What should you do the next few days? Give your medication, and then you review the patient at a given time.
23 minutes past the hour of 2, and I don't know whether he's deliberately doing that, but I haven't heard the word pain. I mean, hey, come on. I mean, hey, what kind of life is that? I mean,
discomfort.
Discomfort.
Call it discomfort. Yeah.
All right, discomfort.
Nortey, don't do that to us. Don't do that.
No, hang on. I mean, people trust us to go into the issue.
details, yes.
Yeah. So, and they will ask as soon as I start. So I mean, make you comfortable, have a talk, deliver the tooth. I mean, come on. So there's no pain but discomfort. If the anesthesia and everything, local or whichever level of anesthesia is working, are you suggesting? I read, and I normally read before I meet you guys because you guys are that good, but I read that the anesthesia will numb the pain sensors or receptors, but you will feel and discern pressure.
That is right.
But pressure is not pain.
No.
Can you explain that to my listeners?
So interestingly, an extreme of pressure can be picked up as pain.
As pain.
If I hold on to my skin like this, for those who could see on Facebook,
right,
for a few seconds it's okay.
All right. It's like a light pinch.
But past 1 minute, it's like, ouch.
Okay.
This thing hurts.
Right.
Because the cells in the area would respond to that stimulus that is attacking it at the meantime.
All right.
And of course, with delivering the tooth, as Dr. Hammond said, it's there's some mechanical motion. So the person would feel the pressure in one direction or in another, safely trying to remove the tooth wholly from the sockets.
All right.
In some cases, we would actually tell you that we have to split the tooth in two and then deliver one piece.
You put on a seatbelt sign.
Yes, we'll let you know that
there will be turbulence.
Yes,
oh my
for the next few minutes. So if you hear a snap, it's fair. Then we deliver it piece by piece. So then we show it to you also that everything did come out as planned.
Okay, great.
And then...
All right. If you just joined us, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm with the dentist, and they are delivering teeth.
Everybody is unique. There are some people, after you've given the anesthesia, their body sort of breaks it down faster. So the anesthesia wears off in these individuals faster than in other people.
Right.
So what we will usually do is that we don't use only one local anesthetic. We have some that are long-lasting.
All right.
Longer acting, and then some are short acting, and sometimes you may need to give the person maybe a second additional one just to make sure that the person
the stubborn ones.
Yes, I mean, every now and then you encounter those ones. So it's a communication with the patient.
Right.
Okay, you're also watching as a practitioner to see if your patient is in pain. Okay, and then you ask the person, "Oh, you feel that this is getting painful?" Then we'll give you extra. Okay, and in fact, I can confidently say that most of the extractions I've done are pain-free.
All right.
The pain is when the anesthesia is being given.
All right.
Okay, and even that one, we have topical gels
right.
and sprays that we can introduce.
Understood. Yeah. Understood. I trust you guys. I trust you. Right. If you don't trust them and you have any questions, you can cross-examine them when I activate the phone line. But let me ask this as well. So you're pulling out a tooth from its socket, right? Root and all. This must involve some degree of mechanical force. Are you using your own strength? Are the tools such that they will do this? And I read about elevators and things you wedge between the tooth and the gum, and you do, is it a macho job? Are you literally physically
not
yanking?
At all. Not at all. That's again one of the myths that people have, that the dentist should be a bole person, but if you go in,
you're not going to be having, 1 foot on the side of the chair and pulling like tug of war.
That will actually break the tooth, and not only the tooth, it will break the person's jaw as well. Okay. So the elevators and laxators you talked about are things to gently move the tooth within the socket. Okay. There are tiny threads that hold the tooth to the bone.
Come and let's do a demonstration. Okay. they brought their toolbox.
Tiny threads hold the tooth to the bone.
Right.
We don't see them, but they are supposed to keep the tooth firm.
Okay.
So when you want to take out the tooth, the elevator and then the laxator go in between the space just to move the tooth slightly.
Rockets.
Right. Try and sever the ligaments.
That's a banchi.
Well, if you want to use that analogy, yes. But the whole idea is to get the tooth to move.
You're teasing it out.
Yes.
All right.
Before you go in with the forceps.
Okay.
And then you move it. And that for every tooth, there's a particular movement.
Okay.
You can't use the movement for a front tooth, for a back tooth. It wouldn't work.
This is why you need somebody who's trained.
You need somebody who is trained to do that.
And knows and can identify if something is going wrong.
Yes.
Okay. Right. 30 minutes past the hour of 2. Normally, typically at halfway, I will activate the phone line so that we can do this together and I can take a break as well and not think too much for you. 030-2216-541. 030-2216-541. We're talking to the dentists. Yes. The oral terrorists. Yeah. They go in there and they terrorize you in there and you still have to pay them. Yeah. So again, forgive me, my reading. But if the tooth is infected or is at some stage of infection or it's compromised, my reading also suggested that during this process of extraction, even though it's being done by a professional, there's the potential or the possibility or probability of introducing infection or bacteria into the bloodstream. Right? And I'm thinking this accounts for some of the antibiotics that are given and so on and so forth. Can you talk a bit about that? Again, my emphasis strongly is the fact that this is being done by a professional who knows what they're doing. Yeah. Is that something that is considered, that we may be spilling something or causing or promoting the introduction of bacteria into the system?
The protocols for attending to a case when you're doing an extraction does require that the instruments are sterilized, pre-packed, and then laid in front of the client. So even within our setup, a lot of the procedures or activities prior to the extraction bring about this clean environment, if I should put it.
You will not work in an infected...
No. For some clients who are unable to chew on the affected side, you have a lot more deposits going in there. We are even more likely to do a selective cleaning of that part of the mouth. Making sure that once we take out the tooth, no debris in and around that section.
So you're doing your infection control as you work.
Yes.
Right.
Yes. So we'd actually have to prepare you for the surgery, as it were. Clean the area up, give you some time, and then you can come in for the procedure. But the antibiotics would go into cover for any other infection that might creep in to the system moving forward. Some are of the view that they will not use antibiotics. But based on the assessment or the case that we would admit, we would see that there are even grades of antibiotics that we would give. We have like entry level, then we have those who are going in for the hardcore guys and those exactly.
And so
so those are some of the few things. But the sterile environments of the surgery is actually one of the main things that will cover for these
great stuff. One of you trying a video call on our WhatsApp line. No, that's a no. We'll extract you right now. The number to call is 030-2216-541. That's the number for Ultimate Health on Joy. Abeku, there's a bit of a problem with the WhatsApp screen, if you can assist, right? Yeah, and I have a caller at this exact time as well. Hello, good afternoon. Hello?
Nortey?
Yes, good afternoon. Who am I speaking to?
Mr. Nortey Dua.
Yes, who am I speaking to? I know my name. What's yours?
Who normally mention your full name?
I know. This is DC from Dental Cavity from Dansoman. You're welcome. Share with us.
Okay, thank you. This is the dentist that was on Thursday, and I made them wash in between. But I realized that after the washing, there was space in between, which maybe when I bring out saliva, there was much space in between. But I realized the space is closing back again. Is it normal? And then secondly, anytime I take chilled water, I feel some kind of pain within the teeth. Is that also normal? Thank you.
Okay, so he had some cleaning and stuff done, and he noticed that after the cleaning, he could discern wider spaces between his teeth, but he says after some time it looks like that is closing. Is that normal? And then he refers also to some sensitivity when he drinks cold stuff.
Okay, so typically what happens when we do the scaling or the cleaning is that last week we talked about plaque and calculus. So if you have solidified plaque, that's the calculus that has stayed in between your teeth for a very long time, and we are looking at, for example, years. once you pick out that calculus, it used to occupy a certain space.
Right.
Okay, so you would feel that, there are spaces in between your teeth after the procedure.
Right.
But this is the beauty of the body. The body is able to sort of remodel itself.
Okay.
So the normal gum tissue that was originally supposed to be in between your teeth that had been replaced by calculus will now start growing back. And those spaces should fill up normally.
Okay. Right.
Yes.
Then sensitivity.
Sensitivity it's not normal for you to have sensitivity when you drink cold water or hot water. Either ways. Okay. There's always an underlying problem, and he must see the dentist to have it sorted out.
Okay. Great. I have another caller. Hello.
Hello.
Yes. Good afternoon. Who am I speaking to?
Good afternoon, Amy. Amy from La Paz.
Amy from La Paz.
Yes.
All right. Share with us, Amy.
Yeah. Please, I have a little challenge concerning the sterility they are talking about.
Okay.
I remember sometimes when I went for this extraction, how they were the same glove that was sent down my mouth or whatever. They come up with it and they use the pen and they write and they enter again. So please, they should look at that.
So what you're saying is your experience is that the observation of infection control. You had some questions there. You said they use the same what?
The disposable glove on their hand in my mouth. Then they go out and they handle the pen, write on the card or something, and go back into the mouth. I think that is not.
Oh, you didn't bite them?
No.
Right, but this is a good piece of feedback. So she noticed the dentist who handled her did stuff, with his gloves on in her mouth. Then he went to handle a pen, did some stuff, came back into her mouth. She says, hey, that shouldn't have happened. Oh?
It shouldn't have happened. Yeah. Yes, and fortunately, there are a lot of spot checks on our practices these days. You don't even the patient that you are seeing might be somebody from the regulatory bodies coming in as a
ghost client.
Yes, ghost client. So there are standards over there, and we must adhere to the standards.
But in this instance, in the chair, with your mouth clamped open or whatever, can you indicate that?
You can. You have the right.
She should.
You should indicate.
Yes.
Right. Okay. Great. I have another caller on the line. Hello. Oh, I'm sorry. Please try again. Good afternoon. My name is Frimpoma in Adenta. I have a 9-year-old boy whose teeth come off too often. To me, I think it's too often. Now his molars have also started shaking. Already he has lost 2 from both sides. I guess that's the molars. Is it normal? Looking at his age, the normal milk teeth have come off long time already. Is it normal? Thank you.
9-year-old might still have some milk teeth in their mouth. What I have realized in practice is that most parents are okay with the front teeth coming off, but once the back milk teeth start coming off, they get a bit agitated. This one I advise, see
a dentist.
Yes, let your fears be.
All right.
We are sure. Yeah.
Okay, quickly, I have a caller back on the line. Hello. Oh, come on! You must be so unfortunate. Please try again. Right, third time lucky. It happens in elections as well. Good afternoon, Nortey. Please find out for me removing of teeth and application of medicine for it to stay strong. Which is the best? Ajiman Joseph, you asked this last time as well. You asked us to flip a coin between removal and, and he's asking again. I need to find a jingle and remove a few of his teeth.
Yes, but we keep hammering this point. Having your natural teeth is always a better idea.
Okay.
It's much better than any form of prosthesis you have. Yes. So
right.
if the teeth can be saved,
right.
Yeah, we'll go for that.
Okay, 39 minutes past the hour of 2. Might have a caller on the line. Hello. Hello.
Hello.
Yes, good afternoon. Who am I speaking to?
Please,
Right, I didn't hear that, but you go ahead quickly.
Please, I want to ask why is it that when a woman, some women, when they deliver after delivery, they have all their teeth removed by itself?
When a woman delivers, they have all their teeth removed?
Yes, by itself.
The teeth come out by themselves?
Yes.
Hey, all right.
After delivery?
After delivery?
Some women, yes.
Okay. So, docs, do women deliver their teeth as well?
No.
No, they don't.
This is what I've noticed.
Right.
Depending on how...
Sorry, doc. There's another person on the line. Let me quickly take that person and come back. Hello?
Hello, Nortey. Good afternoon.
Good afternoon. Is this Oti?
Oti here from Tema. I want to know, Nortey.
Yeah, go ahead.
If you have national insurance, if you go for dentals, can it cover it?
Okay. Right. Does the health insurance cover dental procedures? This is what Oti wants to know very quickly.
Yeah, it does cover some, but not all.
Some. Okay, so you need to inquire what is with regard to what is covered.
Yeah.
Okay, I have another caller. Hello. Hello.
Hello.
Hi. Good afternoon. Who am I speaking to?
Yeah, it's Amy. I'm back.
Amy.
I didn't finish. Yeah.
Right.
That was a second question.
Okay.
Please, I would like to know if there is a dental paste specifically to be used in the morning and then another in the evening.
Do we have toothpaste for morning and toothpaste for evening?
Mm-hmm.
All right. Okay. Right. So Amy comes back and asks, are there time-related or time of day related toothpastes?
No, there aren't.
The same toothpaste.
The same toothpaste should suffice.
Okay. Right. Let's go back to the women who deliver and use their teeth.
So this is what I've realized. As part of antenatal care, dental care is a must.
Okay.
In other countries, I know it's strictly enforced.
Whilst we're checking the progress of your pregnancy, we're checking your teeth.
Checked.
Right.
Not so over here. So you can have somebody who has pre-existing gum disease. Okay, that was there before the pregnancy.
Okay.
And during pregnancy, because of hormonal changes,
right,
and depending on how bad the pregnancy goes, some people do not, even the smell of the toothpaste,
right,
puts them off. They will vomit the whole time. So you can have somebody typically who goes through a whole pregnancy and the oral care is bad because the brush goes in there, it irritates them. The paste goes in there, it irritates them. Mouthwash goes in there, it irritates them. So you can imagine for 9 months, of this going on, the person may have had gum disease before.
So you may have compromised oral health already.
Will compromise the oral hygiene. And then if the person is also not eating well, which sometimes happens in pregnancy, you are not able to eat certain foods that will boost the immune system and strengthen your bones and teeth. By the time you get
we
to
can't
10,
say that. Why is it that women lose their teeth after delivery?
No.
No. Okay.
I mean, I've seen a lot of women who have not lost a single tooth. Because they come, antenatal, they always come for their dental.
I haven't heard that before at all. Another call on the line. Hello.
Hello, good afternoon.
Hi, who am I speaking to?
Ifwa.
Ifwa, where are you calling from?
From Achimota.
Okay, share with us.
Yes. So I have a daughter, she's 11. And then our last dental visit, we were told that her teeth, the whole top, one was missing. So she had an X-ray done, and we realized that it was in the gum, not out.
Okay.
So we are not sure what to do now.
Oh, but who did the X-ray?
We did it at the dental clinic. They had the X-ray done there. So we're told that she will need to have braces on, and I'm not sure if that will be the solution. I just want a second opinion.
Okay, you're asking for a second opinion. That means there is a first opinion. Okay, so it is you who is not sure. All right, I have another caller. Hello, good afternoon.
Good afternoon, sir.
Yes.
Doc.
Yes, Hajiman Joseph.
Please, this is David.
David, okay, right, go ahead.
From who?
Yes, go ahead. You're welcome.
I have a problem. I have two problems. One of them is a bleeding gum. Anytime I brush my teeth, I experience this bleeding.
Okay.
It's taken quite a long time, but that's never stopped.
Okay.
And sometimes when I rinse my mouth with water, the blood just comes.
Okay. And then the second one?
The second issue is I have a wisdom teeth, and then there's this flesh that's lying on the wisdom teeth. Sometimes it becomes turgid and then swollen, and then very painful.
Okay.
I wanted to
right. There's something you haven't said. David from Ho, right?
Yes, please.
I haven't heard you mention that you've been to a dentist.
Yes, I've not been.
You have not been. This is a radio station. I'm sure you're aware. Okay?
Yes, please.
So, yeah, we'll give you the information, but rule of thumb, the kind of things you're mentioning, you should have at least seen somebody, all right? So I'll get my doctors to respond, but it's important. Okay. Right. So he's talking about wisdom teeth, with some flesh around it, which can get swollen. And the first part was
bleeding gums.
Bleeding gums, right? When he brushes, when he raises his mouth. Okay. Do I have any other callers on the line? Nope. Okay. Right. We'll take answers for that. But let me just read through a couple of the messages I have in a queue. Doc, I'm 37 and I have one of my baby teeth. I still have one of my baby teeth. All right. It doesn't hurt or give me discomfort. Should I still take it out or leave it alone at 37? All right. Let me see. What else do I have? Please, I could not get the phone line. You are fast about it. Take it slow for the listeners. 0302-216-541. 0302-216-541. So Accra code and then 216541. Right? Go and stake lotto. Yeah, okay. So I guess you want to call. Make that snappy. This one says, hi, Uncle Nortey. Anytime I chew meat, my teeth become some way bizarre. Some way bizarre from Offenso. Hey, Richard. Okay, what should I do?
Reminds us of last week.
The goat head, though.
The goat head. The smelly goat head.
The smelly goat head.
Hey, please. Let me read this one. Please, last week, your guest said that when we brush our teeth, we should not rinse our mouth with water. Just spit the foam out. Please, let's explain further. Steve. All right? So, docs, please note these down. I'll come back and do my best to remember. Please, there is a hole in one of my upper molars, and it gives me pain. What will I do? My name is Dimbwe Kotua from Barima, right? Dimbwe, and then Kwotua, Kotua, right? Kotua John, okay, from Barima, right? So, upper, cavity in upper molar. Right, it's still a cavity.
Yes. Yeah.
Doesn't matter where the cavity is.
Oh no,
it shouldn't be there anyway.
No,
right. Yeah. So he should see a dentist.
See a dentist pronto.
All right. So the other ones, this one says, okay, the day in Maryland says my niece woke up 2 days ago with half of her face swollen and under her eye and a portion of her cheeks black. Upon further investigation, it had to do with her tooth. And she had no toothache or pain, no sign of discomfort whatsoever. Is it normal? Right? Swollen cheek, part of it blackened. I guess she should be black. But if not, I mean, is this something that is normal?
No. It has to be assessed within the clinic.
Okay.
Yes.
Right. I have another caller. I'll take this caller and then come back and clear up on the stuff we have in arrears. Hello, good afternoon.
Hello, good afternoon.
Hi.
My name is Annabelle, calling from West Legon.
Right, Annabelle, you're welcome. Share with us.
Thank you. Okay, so I went to see a dentist and I was told I have a receding gum. And I just want to find out if my teeth will be taken out if I go back.
Okay, she has a receding gum. She wants to know. I have another caller. Wow. All right. This is what you call a traffic jam. Hello?
Yes, good afternoon.
Hi, who am I speaking to?
I'm Nana from Spintex.
Right, Nana, you're welcome. Share with us quickly.
So I have this hole in my gum, right, the upper gum. It doesn't give me any discomfort, but then with time I feel there's this bad smell which comes from there.
Okay. Is the hole in the gum or the tooth?
I think I have, it's a wisdom tooth, but it's a bit in the gum. It hasn't really come out.
Okay. All right. Okay. So we've had a couple of stuff about impacted teeth. Is that what they are called? Somebody said a wisdom tooth that hasn't come out properly. Yes. They're not sure. They've had an X-ray and so on. This gentleman also shares that he has some form of cavity. He locates it within the gum, but kind of related to a wisdom tooth. Can we speak to some of the things?
So very fast. Wisdom teeth are the last teeth to come out, and they may assume various presentations.
Okay.
They can be straight but buried, can be inverted.
Okay.
But most of the time, they create a pocket between the wisdom tooth and the next tooth that is straight.
Right.
And you could have the gum forming a pocket over that space.
So that could be the flesh that somebody was talking about.
So when you eat, typically food will trap under that pocket.
Okay.
And that comes along with bacteria
who
like that kind of space because there's no oxygen in that area, and that kind of bacteria do well.
Okay.
So every now and then they'll cause inflammation, and you feel that your mouth is swollen. You can't chew on one side.
Right.
Treatment of choice is that if it's an impacted wisdom tooth, which is causing repeated food trapping and swelling of the gum, that wisdom tooth needs to be taken out surgically.
Okay.
And that usually solves all the problem of food packing over there in the swollen gum.
Right.
Then we have the one about the retained milk tooth in the 37-year-old. Now, this is it. Sometimes the tooth is retained because the permanent tooth that was supposed to replace it did not form.
Okay.
Or has formed and is lying impacted in a different direction.
All right.
Okay, so before that retained milk tooth is tackled, it's usually more than one dentist, maybe a general dentist and an orthodontist, maybe even a prosthodontist, because we need to sit down, see whether it makes sense to leave the baby tooth as it is.
Okay.
Okay. The thing is that after some years, the roots may resolve gradually.
Okay.
But if we don't have something permanent for you, there's no need to rush to take out that tooth.
Okay.
So it's a case by case. There are some people you have to take it out immediately for the permanent tooth to come in. Some people too, there's no permanent tooth in the bone, it needs to go.
Okay.
The one person also talked about the hole in the upper molar after eating. He needs to see the dentist for it to be sorted out. Then the rinsing after brushing, the toothpaste. So what we are saying is that every paste has some medicinal component in it, the fluoride. Okay, it needs to be absorbed onto the surface of the tooth.
Okay.
So what most people do is that they brush under 2 minutes.
Right.
Okay, and they rinse out soon after.
Okay.
Work done is 0 actually. So when you brush, spit out the excess.
Right.
You can do your normal chores. Okay, maybe about 15 minutes might be stretching.
So, listeners, the two doctors have not said swallow it.
No.
Or keep it in your mouth.
No.
Spit it out, but the excess,
yes,
without washing your mouth.
Without washing. Okay.
Right. Okay.
And the fluoride that is left in there would do its work. Okay. So after about 10 minutes, I think that is fair. You can go and now rinse your mouth. Okay. What we talked about for those who have sensitive teeth, who use the desensitizing paste, not to mention any brand, but we know the common ones. Okay. At night when you are going to bed. Okay. So here's the catch. It works better at night because you have at least 6 hours of sleep.
Right.
Okay, so spit out the excess and leave the rest of the desensitizing paste in your mouth.
All right.
And you will see that it will do its work very, very, very well.
Right. What else do we have?
So the lady with the bleeding gums. No, there was somebody
a gentleman
about
brushing
gums, but he hasn't been to a dentist.
That's David in Ho.
So we'd advise him to see a dentist. And then the lady with the receding gums. If we are to examine her in the clinic, would realize that she probably has a poor technique of brushing. Or has a choice of toothbrush which is more on the hard side, rather than the medium bristle or the soft. And then also it may be accompanied with some sensitivity moving on. For cases like that, when the assessment is done and she's able to stop that which causes or makes it progress further, you could put some fillings on the exposed parts of the tooth now to cover up for the defects that the gum has left. Then should be able to enjoy much better oral presentation.
The blackening of the
the day's question. Yes, it could be a lot of things. Okay, it might be a trauma, allergic reaction. Okay, there are several differentials. So this is something that needs prompt attention. Okay, whether you're from a dentist, even a medical practitioner, general medical practitioner, should be able to handle that. But it needs prompt attention.
Dede, you are saying that your first 2 questions were not asked. I'm reading a lot of questions. You do tend to ask a lot, right? So I read the lowest one and I was scrolling up. So do bear with us. If you give us 10 questions, and we are global, right? So that's she says, does tooth extraction later on in life affect or cause changes in alignment? And then she asked another one, why use dental crown instead of extracting the tooth? It is an eyesore to see an aluminium-like color in the mouth. Any improvement in the color aspect? Now, these are specific questions, right? And they are case by case. But my doctors will answer them, okay? So sometimes we need to be fair on my guests as well. And
so,
me.
The crown. it's not all crowns that are aluminium in color.
Exactly.
They're different. We have zirconium crowns, Emax. They are very tooth colored.
Right.
Yes. So dental crowns are a way of saving the tooth. If
Right.
you leave the tooth on crown, they will break
Okay.
later on. So we will always go for a crown
Mm-hmm.
when the need is indicated, and then that's extraction later on affect or
Later in
cause.
life.
Yes. See, when you lose one tooth, the teeth. We said this
We
last
said
week.
this last week.
Yes, the teeth on the side may drift apart
Mm-hmm.
or may close the space. And then the tooth on the opposite side may definitely grow downwards because there is no check from
Right.
the opposing tooth.
Mhm.
Okay, so that's why we don't really like pulling out a tooth unless it's really indicated. And
Right.
if you pull out a tooth and there is a means of replacing it,
Right.
we would always advocate that so
Okay.
that you don't have the misalignment
Okay.
that she's talking about.
Great stuff. Hello, Doc. My question about my 11-year-old daughter's tooth still inside the gum at 11 hasn't been answered. I think we talked about the.
She mentioned she has a radiograph or an
Yes,
X-ray.
Okay, so
Right.
that might be an impacted tooth.
Right.
Okay, an impacted tooth fortunately can be treated.
Mm-hmm.
Okay, it depends on how the tooth is impacted, but the orthodontist, that is their specialty. I mean,
Okay.
that is something that an orthodontist can handle very, very easily. So
Okay.
I advise her she can get a referral to see an orthodontist.
Orthodontist.
Yes, an orthodontist.
Okay.
Yes.
Which is also a dentist.
A specialized dentist,
Specialized dentist.
for
All right.
arranging.
Okay.
the
My
teeth.
3-year-old girl, 2 of her front teeth have decayed due to drinking milk in the night. What should I do?
Okay, so again, how you said 3-year-old?
3-year-old.
Okay,
yeah.
so the goal is to prevent this from getting worse. The milk teeth, even though they will fall out, we need them there for as long as possible. Okay, so the dietary modification will need to come in.
Mm-hmm.
The proper hygiene practice, oral hygiene practice, will need to come in. And then the dentist has a way of preventing the decay from, should I say, speeding up, yes, or
Okay.
continuing. Okay,
Right.
so a prompt dental check
Right.
will need to
For
be
the
sorted
3-year-old.
out. Yes, whilst the dietary
Okay.
modification also goes on.
Right. Okay,
Yes.
great stuff. Mr. Nortey. Yes, Auntie. What is the best way to treat dentures? Bisa from Osu.
To treat.
To treat dentures. I don't know whether.
Is it maintenance?
The maintenance, care, hygiene.
So there are types of dentures.
Mhm.
Traditionally, we have the acrylic dentures. Those are the very hard ones.
Okay.
And then we have a newer type, which are flexible.
Mm.
They tend to bend a little bit and allow for some movement. Would ask that it's worn during the day for function, speech,
right.
and all that. But at night, the client is to take them off.
Take your dentures
Yes.
out.
Brush
Out.
brush your teeth.
Okay.
Clean the denture,
Mhm.
and then find a clean container with
Mhm.
water
Yep.
that you could drop it in,
Right.
just to keep it safe.
Hmm.
Main thing is if you leave it on the counter somewhere, if it's in some tissue somewhere,
Right.
it might be tossed into the bin.
Don't lose
and
your
you've-
teeth.
and you've lost that.
And by all means, tell your partner that you have false teeth.
You have false-
For the acrylic types, out of the wet environment or the moist environment,
Right.
it could also shrink
Right.
moving forward and then also have a bad smell. So
Okay.
those are ways of keeping it.
Okay, the guys just don't want me to let you go after week 3. Right, halitosis. A halitosis patient has visited several dental clinics, doctors, and they say the patient is fine. The reactions from the general public suggest he has halitosis. What are the possible issues, right?
Okay. So we are yes, bordering between pseudo halitosis and real halitosis. And fortunately, we have people like Nortey around who can sort us out. So if you have been to
Halitosis can be in the mind.
yes,
All
so
right.
you'll need to see psychologists. Yes, typically to have that
There
side.
is actually a test that conclusively will show
Yes.
whether you have those sulfur compounds and
Yes.
those
Yeah.
and
Yes.
the odor as well.
Yes.
Right.
There's something called the halimeter.
Thank you.
Yes, and then there's
No,
also
no.
the gold standard of you, the dentist, having to inhale.
All right. In
the
secondary
breath.
school, we call it waga. I did 6th form in pre-sec. I think it was called pahi or poho.
One or that, yeah.
Right.
Yes.
But there's, what I'm
Yes.
trying to get
Yes.
across from you guys is that there is a conclusive diagnostic measure or index that can tell you whether you have halitosis and so on and so forth. And the assessment will also show what is causing it. But what we're also saying is that there are some people who are anxious about this and it's not supported by the clinical evidence.
If the patient has visited several practitioners, usually that's where it tends to lead.
Okay. All right. If you kiss somebody and they squeeze their face, it could be something else. Okay. Yeah. All right. I said it. Yes. Just yeah. Maka. Wow. I still have so much to read. Wow. Goodness. I used to have toothaches a few years ago, and a few of my back teeth have been taken out. I admit I wasn't brushing twice daily, but I really didn't eat many sweet things. Listen to this person. I am 35 now, and I've been brushing twice a day. But now it's like my teeth now feel more sensitive and occasionally hurt more than they used to when I didn't brush twice. What could be the reason? This person is looking for an excuse not to brush twice.
You see a dentist.
Yana formerly Na of Spintex. Okay, yeah?
This is what I can guess. Maybe she will now decide to brush harder. Harder brushing erodes the tooth.
Okay.
They will be sensitive.
All right.
Best thing, visit the dentist.
Okay.
Have that sorted out.
All right. Good afternoon, Nortey. I remember when I was young, I changed some of my teeth. Hey, hang on. More than once. Let me start again. I remember when I was young, I changed some of my teeth more than once. Is it normal? Because I know you only change your baby teeth once. This is from Ernest in Abeka.
Yeah. So typical humans change the teeth only once, like you said.
Right.
It could be something else. Or there are people who also have extra teeth.
Okay.
What we call supernumerary teeth. Best thing, have the dentist have a look and then ascertain whether you really had your teeth changed more than once or it is a supernumerary tooth.
Okay. Well, bravo. Super. That's all. Wow. It has been a blitz. Wow. And I thought we were wrapping up. We haven't done fillings yet, but we are full. Gentlemen, this has been totally, revealing, educative. And Linda Inosu says, hey, this has been so educative. And that's why we bring them into the studio. Doesn't matter which field of medicine or practice or healthcare. That's what we try to do. And we have an hour to do it. And then we are extracted. Right, but Dr. Bannerman Agbeshi and Dr. Albert Hammond, it's been totally awesome for 3 weeks. We will come back with you later in the last quarter, and there are a few things we want to lay on. We might even do a few, in quotes, free clinics and see if we can get some converted. All of those who gave their confessions on this show, we need to make sure that the change has taken place. So we'll see if we can partner with them and a few of their colleagues in the association to roll out something like that. But it's been totally awesome having the two of you. And next week, whoever's here, I'll tell them I'm missing you guys. But thank you so much. I pray that all your questions were answered. It was a blitz at the end, and therefore there's a high probability that we may have left something out. Now, it's past 3 o'clock. I'm signing off, but I do know that there's some football, I think it's a Hearts Kotoko match coming up, and the sports guys, after my extraction, will come in as a filling, right? But hey, you know who you support. I'm not going to say a thing, but sports is up next. My name is Nortey by nature. Many thanks to my producer extraordinaire, Abe Kusankofi. I think yesterday he was out there with Usher or Tiwa Savage or those people. Did you guys jam in the rain at some point? Yeah, I thought Usher was wet. It was an awesome production. Global Citizen was great. Up next, us.